Thank you, sir.
Good morning. My study is on the study of visual status in patients undergoing silicone oil infusion. Silicone oil tamponade is often used in eyes with a complicated vitreoretinal pathology. It is usually removed 3 to 6 months after surgery. However, the presence of silicone oil accelerates the cataract progression, and this justifies in performing proactive cataract surgery and IOL implantation at the time of cataract removal. Purpose of the study is to study the visual outcome in patients who have undergone vitrectomy with silicone oil infusion for vitreoretinal diseases at various stages of their treatment. Material and methods. Retrospective study conducted at a registered eye care center in South India. Data of 50 patients who underwent vitrectomy with silicone oil infusion for various vitreoretinal diseases and then SOR with phacoemulsification and IOL implantation as a second surgery were obtained. Data was obtained from the electronic medical records. Demographic details like name, age, gender, eye MRI number were included. And then the BCVA for distance at the time of diagnosis of the condition requiring vitrectomy with silicone oil infusion, 1 month after the primary surgery, BCVA just before SOR plus IOL, and the BCVA 1 month after SOR were obtained. Inclusion criteria: silicone oil tamponade phakic eyes, patient scheduled for SOR with phacoemulsification with IOL implantation as a single-step surgery. And the BCVA recorded was according to the Snellens and then converted to logMAR values. Data was entered in Excel sheet and analyzed using SPSS software 26. Results: distribution of gender, 58% was seen in the males and 56% of the eyes affected was the right eye. And then the BCVA progression, it was found that the mean BCVA had improved after the silicone oil infusion in a significantly, and then the BCVA progression was decreasing just before the SOR plus IOL. And after the SOR plus IOL, there was significant improvement in the BCVA with a p-value less than 0.001. Distribution of diagnosis, it was seen that more number of cases was in TRD, that is 36%, and RRD had 32% of the cases were RRD. The mean age of the affected sample was found to be 55.64 years, and the mean time for progression of cataract from primary surgery with silicone oil infusion to the secondary surgery, that is SOR, was found to be 10.75 months. 62% showed improvement after the primary surgery, but there was no significant change in BCA with variable duration between SOI and SOR. Hussain et al. Documented improvement in BCV of 6/18 or more in 37% of eyes undergoing SOR. That was a study with 98 cases. And in our study with 50 eyes, 40% achieved BCVA for distance better than 6/18. Kevin et al. Also proposed BCVA improved was more after removal of SO, silicone oil and secondary oil implantation in eyes with poor visual acuity than those with better visual acuity. In our study also, there was significant improvement in BCVA after SOR plus IOL. And the conclusion is that in our study, the final BCVA has shown positive outcome after surgical management, that is SOR plus IOL, after various complicated vitreoretinal surgeries. Thank you.
You record only the cataract formation and the visual acuity only. Any secondary glaucoma you estimated?
No, sir.
No, sir.
No.
So how many cases you undergone cataract out of these cases?
So all cases had cataract.
Within one year?
50, yes, within one.
The secondary IOL.
Secondary IOL. Yeah.
So do you done any primary IOL implantation during vitrectomy?
No, those cases were not included. Only the combined cases were included.
So when was silicone removed? During the cataract surgery or before cataract surgery?
During the cataract surgery, the silicone oil was removed. Mean was 10 months duration usually.
Okay.
Thank you, sir.
Why do you test the visual acuity first with the Snellen set and then logMAR? Why?
Because for the statistical analysis, the logMAR values are used. That continuity will be there, unlike using Snellens for the analysis purpose.